The most important thing in diagnosing an anxiety disorder is a very, very comprehensive history. The history should include details about the symptoms experienced by the individual, the duration of these symptoms, onset if chronologically possible, what symptoms came first. Also include the living situation of the person, who are the people living with them, how long are they around the person with anxiety, then their financial situations, the support system that is available to the person, any other medical illnesses that they suffer from, their medications in detail, because all of this would have an impact on the person's state of mind. And even in terms of, it's not just medical and medication that we would be administering, we would need to make several modifications in order to address the anxiety, and therefore the comprehensive history and investigations, which includes, a complete blood count, the electrolyte levels, a thyroid status, all this would comprise the history and then allow us to formulate a care plan to manage the patient. What I can think of is, perhaps one or two reasons why it goes undiagnosed. One is when people aren't looking for it. If you're not aware that it exists, then you don't look for it. Or if it looks like another illness, then you're not probing further to see if there's more to it than what meets the eye. As in, you take a few symptoms, count a few symptoms and probably put it down to a depression and not elaborate on the history to actually uncover that there is a deep-rooted anxiety disorder there. The second reason is people don't come forward. So, unko lagta hai, a lot of family members also probably feel that this is just age-related. Umar ke saath to ye sab chintaएं normal hai, sab chinta karte hain. But what distinguishes it from a normal age-related anxiety and an anxiety disorder is how dysfunctional the person is. So if this person is not getting out of the house because they are so scared of falling, and that is the reason why they are not even doing so many of the other things that they can actually do, it is affecting their quality of life, and that's when we need to address it. So family members also need to be educated about this, that please don't just look at the symptom but see how much of an impact that the symptom is having on the person's life. So these are some of the reasons why it goes undiagnosed for a long time. And perhaps it is diagnosed only when the person reaches a medical practitioner for some other reason, and that's when you see that there is also an anxiety disorder along with another physical health condition.